Hi, this is Mark. In this video, we'll be going through all of the ways that the scapula can move. So, since there are many different muscles that attach to the scapula, and these muscles are attached to different components of the scapula, various regions of the scapula, we could have many different types of movements. We could have elevation, depression, which is superior and inferior movement of the scapula. We'd have protraction and retraction. Protraction is when the medial border is moving away from the spine. This is a abduction type of movement since it's moving away from the body. Retraction is when the medial border is moving toward the spine, and this is an adduction type of movement since it's the medial border is moving toward the midline of the body. And we also have upward rotation and downward rotation. And upward rotation is when the glenoid fossa is pointing more superiorly, and downward rotation is when the glenoid fossa is moving more inferiorly. In this image, we could see a representation of elevation and depression. Elevation is represented by the red outline of the scapula, and depression is represented by the green outline of the scapula. Elevation and depression are the most intuitive movements. I represented elevation by the red arrows. As you could see, scapula is moving superior with respect to its original position, and the green arrows show the scapula moving downward from its original position, and this is depression. Protraction and retraction can be seen in this image, and this image does a very good job of showing both of the movements because it shows the sternoclavicular joint, and beneath the sternoclavicular joint it shows the vertebra, which are both very important components for understanding this movement. The sternoclavicular joint enables the movement, and the vertebra is actually in the definition of both protraction and retraction. In protraction, which can be seen in the red outline of the scapula, the medial border is moving away from the vertebra. And with retraction, which is shown by the green outline, the medial border of the scapula is moving toward the vertebra. And in these next two slides, I emphasize it a little bit more by outlining the red arrow, again moving away from the spine, and the green arrow here is pointing in the direction of where the spine is located. And finally, we have upward rotation and downward rotation. In the series of videos where I go over each muscle that attaches to the scapula, I'll be reviewing how the muscles cause these movements because I feel like this is the least intuitive movement. It's kind of difficult to see sometimes, but the definition is pretty simple. For upward rotation, you have the glenoid fossa pointing upward, and I have that highlighted in red right here. And for downward rotation, the glenoid fossa is pointing inferiorly. So you can always remember upward and downward rotation by where the glenoid fossa is. Upward, glenoid fossa is up. Downward, glenoid fossa is down. And that is all. I hope that you have a better understanding from watching this video. I wish you good luck with your studying, and goodbye for now.